and one of the speakers, one of the academic speakers, very, very well qualified, I'll tell you about that in just a second, came up. And so we just had lunch with Adrian Soto-Mota. Is that how it?
Perfectly pronounced.
Oh, great. I can't believe it.
Perfectly pronounced.
Can't believe it. So Dr. Soto-Mota lives in Spain, about 2 hours from Mexico. I'm sorry. Mexico, about 2 hours from. We said I was going to screw that up.
That's perfect.
So, anyhow, so 2 hours from Jesus, and we'll maybe get a chance to talk about that a little bit more in another video. But here's one thing a couple of things you need to know about Dr. Soto-Mota's background, because of the content that we're going to cover in this video. Not only is he a practicing internist working with metabolic health patients, you know our friend Nick Norwitz with the doctorate in human metabolism from, I keep wanting to say Cambridge, it's Oxford, both of them. So they met because they were both doing a doctorate in human metabolism at Oxford. And so we're going to ask a question that's right up Adrian's alley. I'll start. In fact, why don't I start off now with that question? So, Adrian, given your background as an internist working with these folks, as a someone with a doctorate in human metabolism, what do you think is the best diet? We got paleo, we got keto, we got, and I'm going to ask you a little bit about this cheese in a few minutes, because this is what, he got one of these, and he ate all but 2 of these slices. You don't know the rest of the story. We interviewed another content creator yesterday, and he was very, very, we're not going to tell you who it was. You might guess. He was very strong on you don't want to eat dairy. And as you know, I ate some of your cheese. I eat cheese all the time. So anyhow, I'm answering my own question. Why don't I let you talk?
I think that I will quote here Sarah Hallberg, because she changed my mind like 4 years ago, perhaps 5 years ago, when in a panel she defended the position on perhaps we need less randomized control trials. And the first time I heard that,
you didn't like that?
Yeah, I was like, no, that's not possibly correct. Like, that wouldn't be good for the field, the patients. We need more randomized control trials. And she changed my mind. Trials. Yes, she changed my mind because her point was around, look, imagine we have a clear-cut answer to that question. What's the best diet? Mm-hmm. Like the best overall diet for, the majority of humans walking on Earth. Well, it's good we have that answer, but I will always have patients who don't want to follow that diet for whatever reason.
They don't want to.
Yeah. And
if they don't want to, they're not gonna.
Pointless if you have 1,000 randomized control trials saying this diet is the best one. If my patient... So it's pointless if you have 1,000 randomized control trials with perfect methodology, which of course does not exist, saying this is the best diet, because my patient either won't change their habits, or they can't tolerate the diet. Perhaps they are so eager to try the diet, but they just won't tolerate it. So I know I am not answering directly.
They can even try it, but still they don't want it. So
Absolutely.
It's not going to happen
it's
6 months.
It's still not useful.
Right.
What we need, and this was her point, and I totally subscribe to that now. What we need is to find how does the patient who will benefit the most of this diet looks like. We need good predictors for how does a patient who will benefit, who will improve their health if they follow a particular diet look like. And to now properly answer your question, we should remember that more than 85% of humans walking on Earth live with insulin resistance.
Yeah.
So
That's a simple
it's just a frequency, you know. It's a fact.
right.
It's more likely that if you take random humans, a sample of random humans, most of them, the majority of them, 85% of them, will have insulin resistance.
Yeah.
So the best approach to improve insulin's function is restricting carbohydrates.
Right.
So
Carbohydrates have a poison effect on.
if you are living
those
with
85%
exactly,
of people.
if you have a metabolism that's struggling with metabolizing carbohydrates, and you put more carbohydrates in the system, well, it will happen what you can expect. I mean,
Right.
it just accumulates and makes your problem worse.
Right.
So it's not that a healthy human cannot tolerate carbohydrates.
Right.
It's simply that most humans today struggle processing carbohydrates, metabolizing carbohydrates. And one of the most sensible, reasonable things you could do is why don't you just let your metabolism, why don't you just give it a break, reduce your carbohydrates, and perhaps it may fix itself.
Yeah.
That happens a lot.
That happens
You
all
know?
the time.
So it's just a very sensible first approach to many people on this planet. Now, to follow up on that question, we have 5 major killers in today's world, and stroke, heart attacks, cancer, Alzheimer's, and all of these diseases are either caused or worsened by insulin resistance. So again, you have the the set of all humans on Earth. Mm-hmm. Now you have the subset of humans on Earth with diseases, mm-hmm. or the subset of humans on Earth with insulin resistance, which you could say it's a disease. Well, that's already lots and lots and lots of people. Even what I am trying to say is that even if you have humans without insulin resistance, but they have one of these diseases, it's likely that that disease will worsen if you add to the mix.
Carbs.
Exactly, if you're pushing carbs. So again, it's not that we believe everybody should be eating low carb today.
Right.
I don't think that you are poisoning anyone if you feed them real food, carbohydrates, provided they are healthy. They have a healthy metabolism, which is a minority today. Provided they don't have strong inflammation response to some ingredients in other foods, I guess what I'm trying to say is that the subset of people who can thrive on a high carb diet is, decreasingly small.
Yeah.
And some people can tolerate, anything better than others. And I don't believe we should get into fights on which is the best diet overall. In the end, we have to find the best diet for the person in front of me every single time. And so it happens that in today's medical practice, the person in front of me typically would benefit from at least trying carbohydrate restriction, as a first approach. I am not against drugs. I'm not against medication for sometimes people tell me, are you in favor of SGLT2s? And I typically reply that is asking me like, am I in favor of broom? Like, okay, what am I doing? Like it's
for the right situation.
it's a weird question, or it's like asking me if I am in favor of drugs to lower your blood pressure. Well, is the task to lower the blood pressure? Well, then yes. Is the task to kill a bacteria? No, then it's useless. It's the same thing. It's not that I am
right tool for the right
exactly.
job.
And so it happens that the right job right now is insulin resistance, and therefore the right tool is very frequently a low carbohydrate diet. This does not mean there aren't humans who don't need to restrict carbs.
So let's talk about low carbohydrate and high carbohydrate diet. I just had, and let me tell you where I'm going. So I just dealt with a few comments on one of the videos where we were talking about oatmeal.
Yeah.
And I was saying, yeah, of course, you don't want to instant oats, just the flakes, they're going to be bad for most folks because it just hits your bloodstream. But steel cut oats, and they're more like a BB than they are a flake. And so a lot of people can eat those. Well, I had 2 commenters come back and say, oh, I can't. I try steel cut oats. I go straight over 200.
Thanks, Chris.
So
I know.
the point being is, okay, how do you define low carb?
Okay.
Is there a low carb for everybody? Or does the
Let me emphasize that whatever you're eating, it should be real food. All
so you don't like
forms,
any kind of oat?
all forms of ultra processed foods, regardless if they are keto, if they are vegan, if they are gluten free, if they are ultra processed foods, it's not that they are evil themselves. We sometimes are accused of demonizing foods in general. It's just that if it's ultra processed, it's very hard. It has so many ingredients. It is designed to, hack your satiety and your brain into getting more of that product, because in the end it's something that's not for profit. And it's just harder. It is unlikely you will do disservice to your system if you stick to foods in the shape and form and quality that existed many, many years ago. This doesn't mean that, paleo, then it's the best diet. Because you could also say, of course, that fruits today don't look like fruits 10,000 years ago. Chicken today don't look like chicken 20,000 years ago. So it's not the naturalistic fallacy that's typically floated around when these topics are brought up. It's simply that if you're going to eat carbs, it's safer to eat them in the form they likely existed 10,000 years ago. So
we didn't
apples
have to even
existed. And apples existed 10,000 years ago. Apple juice didn't exist.
Right.
So it's not only, I typically say, it's not only low carb, it should be slow carb, slowly absorbed carb.
Yeah.
You could summarize both with real carb sources, because real carbs are typically lower than a Western diet and definitely slowly absorbed. So you basically end up with fruit, some legumes, and if you're going to eat carbs, well, it better be those. Bear in mind that the incentives for agriculture have now been pushing for versions of vegetables that have more starch, that have more sugar.
Yeah.
But that's how I would put it.
Now, when you bring up legumes, there's a flat one. I'm trying to remember. It's flat, and for some of my patients, it seems to spike them.
Yeah.
Others, not so much.
Yeah. Let me tell you something. 7 years ago, during my residency, I designed and convinced very brave human beings to follow me on a very small pilot, where we would eat the same thing every day for 1 month, then washout period, and then for the other month, the exact same ingredients, exact same quantity, but with insulin stimulating foods altogether, and 16 hours of intermittent fasting, and basically what was a low carb dinner. So 1 insulin spike per day. Okay. Breakfast during that month involved 2 bananas, 2 shakes of hospital shakes, like enteral nutrition shakes, 1 can of beans, 2 250 grams of rice and 4 slices of bread.
Carb overload.
Yeah, absolutely. My glucose never went above 150.
Wow.
Because we were having, and we had
Good.
the early, so it never went beyond that.
Interesting.
If I have the shakes alone, it would go, So it's really a matter of, an analogy I typically use is it's not the same job for your arms to go for 200 push-ups in 2 minutes than if you set them to 200 push-ups over 12 hours.
Yeah.
So it's a totally different job. It's the same 200 push-ups, but your body wants to respond to the same thing. It's the same thing. If you're going for 100 grams of carbs a day, it's not at all for your liver and your pancreas to try to process that if they enter your bloodstream in 5 minutes, or if they enter your bloodstream, along many hours. So it does matter. It does matter the speed in which the technical term is glycemic load matters.
Yeah.
That's the bottom line.
I get a lot of people that complain about glycemic index versus glycemic load.
Yeah.
I'm sure you have an opinion.
Go for glycemic load because you're taking into account how much of the stuff you're eating.
And it's a more practical approach.
Yeah.
It's what you're eating. It's not a theoretical approach to the work.
Exactly.
I gotta quit saying glycemic index. I keep saying that all the time. It's another bad habit I got. So Jesus, any other questions that you think we need to ask?
I just have one very interesting. I don't know if you want to address it. How mad do you make your spouse by fasting or limiting carbs and sugar?
Oh, man.
I read
Now,
that verbatim.
I don't know if you want to tell your story.
I'm not making that up. That's what they asked for.
We were just talking about, I got a divorce over the past 2 years. And that was part of the problem. Part of it was me working a whole lot. Part of it was this. And obviously there's a whole bunch of other stuff. But yeah, it makes the people, if the people, this is a big issue. When we have most of our patients are men. Most of them are 55 and older, but we've got some 30-year-olds, 20-year-olds. If the spouse joins the meeting, it is so important, and it's such a blessing because by far and away, you cannot out-stent, you cannot out-prescribe, you cannot out-bypass a lifestyle problem. And guess what? Among the lifestyle issues, we'll talk about it. HIIT training is important. Resistance training is important. Lower body work. But you cannot outrun a diet. And a diet, unlike some other activities like exercising, a diet is very much a couple's activity. So when you have your partner, your spouse involved and in agreement, it is such a blessing. Now, that's just my personal comment.
I also have direct experience with unsuccessful marriage. So what I can say about that is, what you said is it's just spot on. It's way better to have a couple with lifestyle changes objectives, well aligned, than an already paid annual gym subscription. If I had to bet which of my patients is going to do better in 1 year, the one who already has not only aligned but supportive spouse of a lifestyle change versus the one who already has 1 year prepaid gym, the one with a supportive spouse will vastly outrun. Because in the end, food it's not only it's not only a biochemical phenomenon. It's also a relation. It's also an emotional phenomenon. We do have Yeah, it's a social thing. We have an emotional relationship with food.
Yeah.
And of course that if you are in an environment where you are watched, that's a big part of it. Well, okay, you now are eating something that it's outside your objectives. When you are removed from having the temptation of sweet snacks in the fridge, for example.
Oh yeah.
When you are encouraged to, oh, this new recipe you're learning was so delicious, I wish you can make it again. If you are in that kind of environment, success is just easier. I would say almost inevitable. So it's Dave Feldman, I'm going to quote Dave Feldman here. He says all the time that happy wife, happy life.
Oh yeah.
So it's true. I
We
think
had
that's,
dinner with Dave last night. He said something very similar.
yes, that's of course entirely true. I think that we should all make our best to bring the people that have an influence in our not only lifestyle but well-being to know the objectives we have and to let them know how they can help us. There is no one who loves you who wouldn't be supportive of something that will be good for you. So the same way if you're looking for a job and you let people around you, hey, I'm looking for a job, let me know, help me if there is an opportunity, whatever. The same way for your health objectives. Let them know, hey, I am trying to cut carbs. Can we perhaps change the menu for Christmas dinner?
Yeah.
Hey, I am trying to,
Breakfast.
I am trying to do intermittent fasting. Why don't we have lunch instead of dinner? Let them know.
Yeah.
So
Very true.
just an update. Take ADSR, the one who made that comment,
Uh-huh.
and now she's sharing. What makes it even worse is we both were about 250 pounds, and she's still there. I'm 147 now.
Ooh.
Yeah, that's a warning I typically say. That's true. Let me say something.
Ooh.
Sometimes what happens is that
That's tough.
especially, I think that this is especially true after menopause. If you have a couple where both want to reduce their weight or improve their metabolic health, it just happens faster for men.
Yeah. Men have it
So
easier. There is
exactly,
no
it's
question.
just faster,
Men
So
have it easier.
something I typically say is, if you are in a men and woman relationship or marriage, I typically say to women, don't get frustrated. It
Yeah.
doesn't mean you're doing anything wrong. It doesn't mean it's not working. It's just that your process is slower, because it can be discouraging to see a partner that they're doing so great. I am putting the same effort, sometimes even more. Why I'm not seeing the same results?
Yeah.
So I think that's a very important warning for
Yeah.
couples who are engaging in a lifestyle change.
And it's not all advantage to men. Men are the ones that have heart attacks earlier
Yeah.
than women. So, there's things that go along with being a man or being a woman.
Yeah.
Gender differences.
Don't get discouraged by those differences. And yes, it may happen slower for some, but you'll get there.
Yeah.
And even if it's not at the same speed for both members in a couple, it's better if they are connected and aligned, and they also share that same trip. They share those objectives.
So, a couple of quick questions at the end. You said we get emotional about food.
Yeah.
And when you so politely offered me some of this, I sort of thought you might be getting a little emotional when I said, yeah, I'll take a couple of those. I'm just kidding. Now, here's the question. Casein.
And casomorphins.
Yeah.
Casomorphins.
Casomorphins. So, we heard yesterday a very strong statement, which I'm obviously a little bit critical of, at least for me,
Yeah.
that these things make you want to eat just like sugar makes you want to eat more. And there was further, justification, further statements about it saying, look, all dairy products basically came from food that was developed to make you grow fat
Yeah.
because it's for babies.
Yeah.
So I get, given the role that I play, I get a lot of people asking about dairy. I never really had that much of a problem with dairy specifically. I haven't studied dairy that deeply. I heard that yesterday and I said, well, that makes sense, but I'm not so sure that it makes sense for everybody.
I agree. Let me share quickly something. That's a very cool collaboration I am a part of now. Dr. Jen Unwin is leading very large group of researchers and scientists in trying to convince WHO to recognize food addiction as an official diagnosis. And in concrete, food addiction to ultra-processed foods. It's a very interesting quest and problem, but without getting into too much details, part of the problem, there was an unsuccessful submission to WHO years ago, and WHO basically replied back on, we don't know which ingredient, which substance in food is the one that it's addictive. It's hard to make the case for an addiction unless that's identified. And clearly not all food can be addictive because people are capable, lots of people are capable of eating food without getting this addiction-like behavior, of not being able to stop despite it's harmful, not...
So they did not recognize any food addiction.
Yes. They said that the strongest case could be drawn, for example...
If you had been the chair of that WHO committee...
I think it would have been different. Precisely
meaning
because...
you recognize
yes.
addictions.
And part of my
I have a sweet side
Oh,
addiction.
that's exactly where I was going after. That, as any real Mexican kid, I was a fat one. Because we are world champions in childhood obesity.
Yeah.
So I had my good share of extra pounds. And I am sure that because my brain developed in an obese environment, I do have an unhealthy relationship with certain foods. So I can totally identify some foods that I can binge on, despite knowing they're not good, despite wanting to stop, despite not even enjoying that much any longer, but I just can't stop. So I do perceive myself as a food addict, as a recovering food addict, and there are some foods I would simply not touch because I know myself, it will be very hard to restrain. Now, part of the debate on the consensus efforts, we had a meeting in London a few months ago, in May this year, to try to, agree on which words exactly to write to the WHO and which definitions to agree upon food addiction.
You're on this group.
I am on this group with them.
Okay.
So part of the debates come on, is cheese processed food or not? Because one of the more known and you could say respected classifications for processing food is the NOVA classification. And it's not perfect. Nothing will be. There are points of valid criticism to the NOVA classification, but basically it's a 1 to 4, 4 being the most processed possible, and 1 being as you would find it in nature. So cheese.
So I'm sorry, go ahead.
What you would find in nature is cheese. It's milk, not cheese.
Right.
So should we, where should we put cheese? Is it in the processed side of things, or is it in the unprocessed side of things?
It's more processed than milk.
Where would you put bread? Where would you put?
Clearly processed.
So it's if we had to draw a spectrum in which you have food exactly as you would find it in nature versus, I don't know, Cheetos or something like that, clearly processed, where would you place those foods? And cheese is actually a contentious point because lots of people who identify themselves as struggling with food addiction or addiction-like behaviors typically say, I can binge on cheese.
Yeah.
Like it's a food that will make me want to eat more, that will make me behave like that.
So there are people to whom you have cheese addiction.
Yes, absolutely.
I'm not surprised.
I'm not either.
I'm not one of them.
Now let me tell you my story before walking into today's lunch.
Uh-oh.
We basically had two options. We had charcuterie, we had salted meats,
Yeah.
cheese, and eggs,
Yeah.
boiled eggs.
Yeah.
So from those options, the safest two for me is cheese and eggs because I can binge more on salted, on salted meat than on cheese. I get more satiety out of cheese than out of unsalted meat. This doesn't mean it's true for everyone, but I mean,
Are you a cheese addict?
I don't think I am, but I
Okay.
can finish a kilogram of jamón serrano,
Yeah.
a kilogram
Now,
of
wait a minute.
chorizo, a
Jamón-
kilogram of. It's easier for me to overeat those foods. So
Jamón serrano is a type of ham.
yes,
A processed
yeah,
ham.
yeah, from Spain,
And
delicious.
chorizo is a processed meat.
It's also processed meat. It's
Both very good.
sausages, for example. I mean,
Yeah.
I can eat lots of
Chorizo sausage.
sausages.
Yeah.
So that's why I decided that lunch today was 4 boiled eggs and cheese.
Yeah.
This doesn't mean
Well-
that some people will have a harder time if they had gone for cheese.
Yeah. Well, this has been very enlightening. Very, very
Um,
good. Any other suggestions? Jesus, I do have one more question before we go.
Go ahead, go for it.
Cambridge or Oxford?
What?
Thank you very much.
Thank
It's
you.
been great. I really enjoyed it. Very informative. So, what we'll do now